Physicians face many communication dilemmas, but one of the most daunting is talking with patients about medical errors. These challenges multiply when an error involves a possible delayed diagnosis of cancer. A cancer diagnosis is always frightening. Most patients are aware that early diagnosis is desirable, but they have no way of knowing the impact of a delay on their own prognosis. In the face of such uncertainty, patients may imagine worst-case scenarios. Clinicians also worry about disclosing delays to patients, given that delayed cancer diagnosis is a common source of medical malpractice claims. This module focuses on the principles and skills underlying effective disclosure conversations, especially around a potentially delayed cancer diagnosis.
Some months ago, Mary McCarthy, a 50-year-old female with a history of hypertension, reported a breast lump to her PCP, Dr. Bloom. Dr. Bloom examined the breast and found a cystic area that did not feel significantly different from the rest of the breast tissue. Since the patient was 2 days before the start of her menstrual cycle, Dr. Bloom recommended that Mrs. McCarthy be re-examined at a different time during her menstrual cycle. No imaging studies were ordered, and Mrs. McCarthy failed to schedule a follow-up appointment for a repeat exam. When Dr. Bloom went on leave, Dr. Buckley assumed care for Mrs. McCarthy. Mrs. McCarthy saw Dr. Buckley for hypertension on several occasions. Once her hypertension was controlled, Mrs. McCarthy again brought up the breast lump. Dr. Buckley was surprised. She was not aware that a breast lump was an active issue. Dr. Buckley then reviewed the chart in detail. She saw Dr. Bloom's note documenting the cystic area in the left breast where the patient had noticed a lump, and his recommendation that she be re-examined at a different time during her menstrual cycle. When Dr. Buckley asked Mrs. McCarthy why she had not brought the breast lump to her attention sooner, she replied, "I thought if it was serious, you would have checked it when I was here for my blood pressure." A subsequent breast biopsy revealed cancer with 3 positive axillary nodes. The surgeon has told the patient about the diagnosis of cancer. As the patient reflected on this sequence of events, she wondered whether it could have been diagnosed earlier and decided to talk with Dr. Buckley about it. Let's watch as Dr. Buckley talks with Mrs. McCarthy about her concerns.
How could this happen? I told him I felt something, but he wasn't worried about it. And now I have cancer. How could he miss something like that?
Yes, I know how you must feel.
And you missed it too.
Well, we don't know what might have been. I mean, maybe we could have diagnosed this earlier if we had ordered the test sooner. Maybe not. I see over here that Dr. Bloom recommended that you come back for another check later in your menstrual cycle.
I don't remember him telling me that. And I did see him again, more than once.
Well, I wish that you had reminded Dr. Bloom about the lump or that you had brought it up to me during our first visit.
But why didn't Dr. Bloom do something? He should have done something. Then. Right then.
I don't know why he didn't, but there's no point in looking backwards. I'm sure that Dr. Bloom wishes that he'd caught it earlier. I wish it had been caught earlier. I'm very sorry if this didn't go as well as it could.
I can't believe this has happened.
Well, learning you have cancer is awful, but let's not dwell on the past. The most important thing is that we move forward and we see where we can go from here. I want you to make an appointment with oncology, and when you call them, you tell them that I said you should be put in the front of the line for an appointment, and they can call me if they have any questions, okay? I'm sure that this will go smoother for you going forward.
How much of a difference do you think it made that it was in there growing for months?
Well, I don't think it made any difference. I mean, with this kind of breast cancer, a matter of months really doesn't make any difference in the kind of treatment you have or how you'll do.
But they always say it's better if you catch it early.
Well, when we talk about early or late, we're really talking in terms of years, not months, and I doubt if this very short time will make a difference in the treatment that you need or your ability to beat this.
I hope that's right. I don't want to think this is worse than it has to be.
Well, call oncology and tell them that you need to be seen right away. This is a definite bump in the road, but let's focus on the future and get you started in some treatment.
This conversation didn't go as well as Dr. Buckley had hoped. There are several key elements of effective disclosure. Acknowledge the error, explain what happened, apologize, discuss lessons learned and plans to prevent recurrences, empathize with the patient, and explain what will happen next. These elements are especially important when faced with a discussion about a potentially delayed diagnosis of cancer. Dr. Buckley did not acknowledge that an error occurred or explain what had happened. Instead, she implied that the patient was responsible for the lack of follow-up. Dr. Buckley may have thought she was apologizing when she said,
I'm very sorry if this didn't go as well as it could.
but the word if makes the apology sound insincere. Obviously, things did not go as well as they could have. A cancer diagnosis can be distressing even in the best of situations, and this concern is heightened when the patient worries there was a delayed diagnosis. Dr. Buckley was trying to empathize when she said,
Yes, I know how you must feel.
but the patient probably didn't believe that Dr. Buckley truly understood what she was going through, or that she cared. Dr. Buckley may have been trying to be reassuring when she said,
Well, I don't think it made any difference.
but the patient may well encounter other opinions in the future about whether this delay lowered her chances for a full recovery, further undermining her trust in Dr. Buckley. Dr. Buckley does not offer to help with setting up an appointment with oncology. Instead, she says,
Well, call oncology and tell them that you need to be seen right away.
at no point does Dr. Buckley indicate that she has learned from what happened, nor does she indicate that she will take steps to prevent a recurrence. Overall, Dr. Buckley's tone and body language are closed and defensive. Her eye contact is poor. Altogether, these shortcomings in the disclosure process convey to the patient that Dr. Buckley doesn't really care about what happened to this patient, further heightening the patient's suffering. Here is another version of the conversation. Notice the change in Dr. Buckley's sensitivity to the patient's feelings and how she acknowledges her distress. Watch as she acknowledges that an error occurred, explains what happened, expresses sincere regret and apologizes, offers realistic reassurance about the impact of the error, offers help in setting up the appointment with oncology, makes it clear that she has learned from what happened, and commits to taking steps to prevent a recurrence of this error.
How could this happen? I told him I felt something, but he wasn't worried about it. And now I have cancer. How could he miss something like that?
I know it's very upsetting. I can only imagine how you must feel.
And you missed it too. I could have started treatment months ago. Months.
You're right. This probably could have been diagnosed earlier if we'd ordered the test sooner. In retrospect, I wish we had. I didn't realize that you had felt a lump. It was on your chart, but I missed it. I was worried about your high blood pressure, and I was so focused on that I missed his note that you felt a lump.
But why didn't Dr. Bloom do something? He should have done something. Then, right then.
Well, I'm sure Dr. Bloom wishes that this had been caught earlier. I know I wish I'd checked to see if the lump was still there when I first saw you. I'm very, very sorry that I didn't follow up on this immediately.
Yeah, me too.
Well, learning you have cancer is awful, and thinking that it could have been caught sooner is even more devastating. I'm very, very sorry. I'm going to call ahead and make sure that we can get in the front of the line for an appointment with oncology. Is that all right with you?
I guess.
And I will do everything I can to help things go smoothly for you.
How much of a difference do you think it made? That it was there growing for months?
Well, there's no way to know, but with this kind of breast cancer, 6 months or even more usually won't make a difference in your treatment or how well you will do.
But they always say it's better if you catch it early.
Well, when we're talking about early and late, we're usually talking about years, not months. And I don't think that these months will make a difference in your treatment or in the outcome. But we do take this delay very seriously.
I hope you're right. I don't want to think this is worse than it has to be.
I would feel exactly the same way.
Okay. What do I do now?
Well, I'm going to call Dr. Upshur and tell her that I want you to be seen right away.
Okay.
I'm very, very sorry that we didn't get you tested sooner. I know that I have really learned from this, and I'm going to work with Dr. Bloom to make sure that nothing like this happens again. The most important thing is that we focus on the future and we get you started on some treatment.
Let's examine how Dr. Buckley responded to Mrs. McCarthy's concerns about a delayed diagnosis this time. She was sensitive to her feelings. She acknowledged the patient's distress without implying that she knew exactly how she feels. She also allows her own distress with what happened to show.
I know it's very upsetting. I can only imagine how you must feel.
She acknowledged that an error occurred and explained what happened.
You're right. This probably could have been diagnosed earlier if we'd ordered the test sooner. In retrospect, I wish we had. I didn't realize that you had felt a lump. It was on your chart, but I missed it. I was worried about your high blood pressure, and I was so focused on that I missed his note that you felt a lump.
As she explained what had happened, Dr. Buckley made it clear that she was focused on the patient and on taking care of her. Yes, she missed the notation about the lump, but she did care about the patient. Dr. Buckley expresses regret and apologizes, and she does so more than once. Early in the conversation, she says,
I'm very, very sorry that I didn't follow up on this immediately.
Notice that this apology includes an acknowledgement of her responsibility. She is not just generally sorry, she is sorry for her omission. Later, she says,
Learning you have cancer is awful, and thinking that it could have been caught sooner is even more devastating. I'm very, very sorry.
She is acknowledging the emotional impact of the event on the patient and expressing regret for the patient's suffering. Near the end, she reiterates,
I'm very, very sorry that we didn't get you tested sooner.
She offers realistic reassurance about the impact of the error. When the patient asks about the impact, Dr. Buckley says,
Well, there's no way to know, but with this kind of breast cancer, 6 months or even more usually won't make a difference in your treatment or how well you will do.
This is a true statement. It would be dishonest to deny the uncertainty. Later, she says,
And I don't think that these months will make a difference in your treatment or in the outcome.
This provides further reassurance, but makes clear that this is her opinion. She offers instrumental help by setting up the appointment with oncology.
Well, I'm going to call Dr. Upshur and tell her that I want you to be seen right away.
She explicitly states that she has learned from what happened.
I know that I have really learned from this.
She states that she is going to take steps to prevent a recurrence of this error.
And I'm going to work with Dr. Bloom to make sure that nothing like this happens again.
Her body language is open. She faces the patient without a computer or clipboard getting in the way. She looks at the patient, touches the patient, and shows she is listening. And notice what Dr. Buckley avoided doing. She was not defensive. She did not minimize what occurred or the impact. She did not deny that an error occurred. She did not shirk responsibility for what happened or place the responsibility on the patient. She did not minimize or avoid the patient's emotions. These are the kinds of human and professional interactions that can make a tremendous difference in the patient's state of mind, in the cooperative pursuit of a treatment plan, in the patient's trust in your ability, and ultimately in your enjoyment of the practice of medicine.
Conversations about medical errors are hard but crucial. When something has gone wrong, effective communication can make a real difference to both the patient and the provider, especially in cases where patients are concerned about a possible delayed cancer diagnosis. Empathic communication is vital. Be sensitive to the emotions the patient is experiencing, acknowledge and validate them verbally. When an error occurs, patients often suffer emotionally as well as physically. Lives may be disrupted and family members affected. It is helpful to be sensitive to the wide-ranging impact of the event. Explain what happened. Be honest and forthright. Be realistic in talking about the consequences, how it will affect the patient's health, and what will be done to care for her now. Don't speculate, but don't withhold information. Don't leave the patient to connect the dots. Explain your role in the event and avoid blaming others, including the patient. If the event was preventable, consider saying so explicitly. Tell the patient what should have happened. Encourage the patient to ask questions. If you don't have an answer, say so directly. I don't know. I'll find out and get back to you. Again, avoid speculation. Most patients want an apology. They want to know that those involved care about what happened to them and sincerely regret what occurred. Physicians worry about admitting liability through apology. If liability is a concern, talk to your risk manager before talking with the patient. Patients want to know that those involved take what happened seriously, that they have learned from it, and that they are taking steps to prevent the error from occurring again. Make sure the patient knows what will happen next in their care. Facilitating those next steps also helps to communicate that you really do care. Before you close the conversation, ask the patient if she has any final questions. Answer her questions honestly and clearly. Make sure the patient knows how to reach you should she have additional questions. Consider identifying an alternate contact person in case you can't be reached or if the patient would prefer to talk to a third party. In some situations, a follow-up meeting will be appropriate. Offer to meet again if you sense doing so would be helpful, or if the patient expresses a desire to meet again. Consider working with a disclosure coach in advance of the discussion with the patient to plan carefully what you want to say, prepare for possible questions from the patient, and practice the language you will use. By far, the most common cause of ineffective disclosures is a lack of planning and preparation. Taking 10 to 15 minutes to get ready makes a big difference in these difficult discussions.
When something goes wrong, patients expect and deserve a complete, thoughtful, and compassionate explanation, including an acknowledgement that an error has occurred, an apology, and information about how recurrences will be prevented. Disclosure conversations are never easy, even when they go well. Rebuilding trust is hard and can take time. Talking with patients about a delayed diagnosis of cancer is especially hard and places a premium on careful planning and attention to the key disclosure skills: information sharing, empathic communication, explicit apology, and acceptance of responsibility. By learning and practicing these skills, we can make a positive difference in how patients perceive and interact with their physicians.